Hello, everybody, and welcome to the Power of Africa conference. My name is Lwati Lenkala, and I'll be your moderator today. I am the Chief Operations Officer at a startup company called Doctors E Consult. We are a telemedicine platform based in Botswana that essentially connects doctors, pathology services, and pharmacies, as well as patients, all into one virtual place. Now, today we're going to be talking about strategies to expand quality health infrastructure across mainstream Africa. Now, I'm not alone. I'm joined by esteemed panelists from all across the globe. Now, we have Dr. Ademola Adiwele from Nigeria.
My name is Dr. Ademola Adewale. I'm originally from Nigeria, but I'm currently based in Orlando, Florida. I'm a practicing emergency medicine physician of over 20 years of experience. And during those years, I've been involved in a lot of public health initiatives. I've run extensive medical missions all over the world. And recently, I started focusing on the health and well-being of men. And that's because I understand that a lot of our men are not taking care of their health. And my mission for the rest of my life is to work on keeping men healthy. At the same time, as we think about men healthy and overall health itself, we cannot forget about the diaspora. People are suffering. They need improved and enhanced healthcare services. And I think having this kind of forum to discuss strategies to implement that is a way to go. Thank you for having me on the panel.
Thank you so much, Dr. Ademola. Next, we have Mary Claire from Cameroon.
Hello, my name is Marie Claire Kuja. I'm a nurse by profession, and I've worked in the New York healthcare system for over 15 years from a CNA to an LPN and then to an RN. I'm currently in Cameroon now, where I started Kuja Eco Productions Limited, which is a sanitary pad brand that uses banana stem fibers to make sanitary pads. I'm very passionate about women's health and wellness, and to be here today to contribute, to add my voice to how we can move the healthcare system in Africa forward is a joy to me. Thank you for having me.
Thank you so much, Mary Claire. Next, we have Lillian Odiwole from Nigeria.
Hello, everyone. Thank you so much for having me. My name is Lillian Morenike Oduwole, and I am based in the United States. I'm an award-winning family nurse practitioner, and I am so excited to be here. I have almost 20 years of experience in the healthcare industry, and I own a beautiful IV hydration and health and wellness business. It is called Dove Hydration and Wellness. I also expanded my business to include consulting and teaching, which is Lillian Morenike Consulting. Recently, I actually traveled to South Africa to help teach South African nurses on the mission fields the importance of implementing IV hydration. I can't wait to continue to expand my expertise in Africa. And I'm just so excited to be here. Again, thank you.
Thank you so much, Lillian. I think all the panelists will agree with me that today we're about to divulge a topic that has been on everybody's lips. We're talking about health infrastructure in Africa and how we can actually improve health infrastructure in Africa. You know, I know for one, I'm based in Botswana, and I know that our health infrastructure is really not good. And with COVID, it just exposed everything. You know, we had one hospital that was dealing with everything to do with COVID, and it was really just a disaster. Now, you know, I'd just like to find out from Mary Claire, before we just proceed with the panel, how is health infrastructure in Cameroon?
Health infrastructure in Cameroon is terrible. It's really bad. Well, I have to be honest. I think we have one doctor to about 1,000 patients. And then the public hospitals are terrible. The nurses are not well trained and are also very mean to patients. And so the healthcare infrastructure in Cameroon is not the best. And then they still have a system here where if a patient is sick, they go to the hospital, they have to pay before getting treatment. And so many patients are dying because of preventable causes, just because of all these reasons.
Thank you so much, Mary Claire. And I think I share the same sentiments. You know, I think it's something that's just happening all across Africa. We don't have enough health infrastructure. And I think that's a lot that many of us would agree on. Now, I just want to take it to you, Dr. Ademola. What do you see as the main obstacle that's actually hindering us from expanding health infrastructure in Africa?
Oh, thank you for that question. Let's think about Africa as a corporation and with a leader. And when you have a leader, you have to have values. And when you have values, you have to have a vision. And you have the vision, you have to have a mission. So let's say I'm a leader of an African country now, and my mission is to make sure that everyone have access to better healthcare system, to build health infrastructures, to build good road, to have clean water supply, and all those basic infrastructures that's needed for you to be healthy. That's my mission. So I have a vision where I see Africa healthcare system that's similar to anywhere else in the world. So that's my vision. However, if my values are not aligned with my vision cannot be clear and I cannot execute my mission. So what I see with us in Africa is the fact that most of our leaders, their values are not the kind of values that will foster promoting the vision to execute the mission. So let's say if you have a leader that's of good character, that of good moral ethos, that believes in caring for others, that believes in, should I say, respecting others' needs and not about self alone, that stay away from nepotism and tribalism and focus on the people itself and rid themselves of corruption and unethical behaviors, these kind of leaders cannot lead you because their vision is corrupted and they cannot execute the mission. So until we start having leaders that have vision and that have values that's of moral standard, that put others before themselves, that are servant leaders, and that shy away from tribalism and nepotism, it's going to be hard to move forward. And the only way to move forward is for us at the grassroots level to take the initiative in our own hands and make it happen. If we sit back and rely on the leaders, and to be fair, not every leader is corrupted, but most are, So for the ones that are doing the right things, we need to applaud them. But for the ones that are doing the things that are, should I say, contrary to the vision or the mission they espouse, we need to just ignore them. And we, like this panel right now, take the initiative in our own hands and trying to figure out how to make it happen on our own.
Thank you so much, Dr. Adimole. And, I couldn't agree with you. I think there is a serious leadership deficit in Africa. Look at the time during COVID where a lot of countries were actually donating to African countries to try and improve their health infrastructure. But most of the leaders just use that money on things that were not meant for the youth, right? So I think I do understand you when you say it's a leadership vacuum. This is one of the reasons why we are where we are in Africa. Now, I'd like to just pick your brain, Lillian. What kind of systems do you think need to be put in place to actually improve the health infrastructure in Africa? We've seen the problem. Dr. Adimole has just expounded it for us. So what do you think needs to be done? What systems need to be put in place?
Thank you so much for that question. I thought long and hard about what can Africa truly do to be successful in implementing an appropriate infrastructure. When you don't have food to eat, when you don't have money to purchase the food, when your colleges are closed because of strikes or professors not being paid or whatever other issues that's going on, when there's uprising because of issues in the community and pure, issues that just cannot be surpassed with normal economic progress. How can we address health? We can't address healthcare because we don't have a solid foundation. Dr. Adewale made very great points. The character of the leader is going to drive the country. So if your character is off, your thinking is off, right? So how can we succeed if we don't have a moral compass pointing north to do the right thing? So what we need is a better economy. The economy of Africa needs to be stronger. Africa is a rich continent. Excuse me. It's a rich continent, and every resource comes from Africa. So why can't we progress in establishing a firm economy so that our healthcare system, the dollars that different countries use to spend in other countries for their healthcare, like our Nigerian leaders spending billions in other countries, right? For appropriate healthcare. Imagine if they use those dollars in their own country. How can that boost the economy? How can that fix the lack of medical doctors that are available to teach and to help the community? How can that reduce the load on the nurses in the hospitals and to even improve their skill set, bringing in consultants like myself and like Dr. Adewale and like Miss Marie, bringing us in to really improve and boost what is going on in our individual countries. If we use our dollars appropriately from our own countries, Africa will progress beyond measure.
Thank you so much, Lillian. As you're speaking, I can actually see that this is something that is very dear to your heart. And I know because you said these are topics that really touch your heart so much. I think we got all that emotion from that. And like you're saying, I think it is true, like Dr. Adioli said, our leaders need to prioritize better. We need to prioritize better. We need to make health a priority. Right. So, Marika, I just want to pick your brain from your perspective and your background as a nurse. What would you say some of the best options to actually improve our health infrastructure are?
Okay. For me, I think primary health care is one of the best ways we can do to expand our healthcare system in mainstream Africa. And I say so because I feel that primary healthcare is the backbone of a sustainable healthcare system. And as Dr. Adewale said earlier, when the water is dirty at the top, the bottom will be dirty as well. So the leaders have failed. And so what do we do as the leaders these days, as the group of Africans or the diasporans now? We have to look elsewhere. We have to strategize different ways of doing things. And I really feel that establishing clinics in all communities can go a long way. A lady that I'm here in Cameroon at the moment, and there's a lady who passed away not long ago. She had a tumor in the breast, and just talked to people in her community, and they said, "Oh, it's a boil, could be a boil." And others said, "Why don't you go to the hospital?" And there was no clinic at all. There was no health center in the community. And others said, "Go to Baba." Baba are those herbalists, we know them. And then she started going to Baba because she didn't have money to pay transport to a nearby hospital or to a hospital that could do a mammography on the breast. So she thought about the cost of paying transport to the hospital and all that, and it was too much for her. Now she turned to the herbalist and started taking all these concoctions. And by the time the family saw that it was really bad, they borrowed money and took her to the hospital, and she was at stage 4 and eventually passed away. And this is 1 in a million cases here in Cameroon of people who die from preventable causes, because there is lack of primary health care in their communities. If there was a clinic in this community, the doctor, the nurse practitioner, or any doctor that she meets at the hospital would have been able to tell that this is a cancerous tumor and not a boil, where she passed on. And so many people are dying here from diabetes. They are getting into comas. People are dying from high blood pressure. It's a silent killer here in Cameroon. But if there's a primary care, there's a clinic in many communities where they could easily access those clinics, the doctors will be able to help dictate those illnesses and treat them on time. So I feel that primary healthcare is one of the best ways to go. And in this primary healthcare, the clinics also have to train a lot of community healthcare workers who go door to door and knock at the doors and ask, is there a grandpa in here with arthritis, for instance, that it can help? Is there someone with high blood pressure that it can help to prevent stroke in the nearest future? Is there someone here with diabetes that they can help to prevent coma? Is there a teenage mother here that they could help to prevent maybe number 2 and 3? So if community healthcare workers are trained in many different communities and go to these places, the healthcare system will be able to go a long way.
Thank you so much, Mary Claire. And it's beautiful insights, because I believe you have firsthand information as you work with these people. You know, being a nurse, I'm sure you get to interact and you get to know that the primary healthcare is where we should be investing our time in. You know, I think this is a very beautiful discussion, because Dr. Adimolu first started off telling us some of the problems that he had seen, the leadership vacuum. Dr. Lillian went in there and she gave us the emotions that, you know what, we need to now invest our money. Africa needs to reprioritize. And then you came in and you just told us that we also need to prioritize primary healthcare. Now, let's not forget one thing, you know, we're in a digital economy, we're in a digital era, right? So where can technology actually fit in when we talk about infrastructure and improving our healthcare systems in Africa? Surely it must fit somewhere. And Dr. Adimolu, I just want to ask you now, how do you think we can leverage technology to actually accomplish quality health infrastructures in Africa?
That's a very good question. And in order to leverage technology, you have to have the infrastructure. To have the infrastructure, you need money. And to execute anything, you need money. And even the people that be running the digital world needs money to get paid and to execute. So it's good to have a macroscopic view of what digital entity can do to enhance healthcare in Africa. But the problem is the infrastructure is not there. However, based on the rate of fintech development in Africa right now, especially in Nigeria, I just came back from Nigeria 2 weeks ago, and there's a lot of fintech innovation going on there now. And such as, I heard about it, I met with some people the other day, we talked about some initiative in South Africa, where they understood that a lot of women are dying during childbirth from bleeding to death. So now they begin to use drone technologies to transport blood to remote areas to make sure they have blood accessible to them, to be able to transfuse them so they do not die from bleeding to death. So that's one way that we can leverage technology to get to remote areas. The other thing is the advent of telemedicine. And Mr. Kaller, I applaud what you're doing, and I'm trying to do the same in Nigeria right now. It's the telehealth. The idea that most people in Africa have cell phone. Almost every corner you go to, someone has a cell phone. By you having access to cell phone, that means inadvertently you have access to telehealth. So you can see a doctor on the phone, and having a collaborative effort between pharmacies, laboratories, and physicians, having a platform that can reach the masses and be able to say, you know what, you need a doctor where you can't go to that clinic because it's packed, but I can see someone in the comfort of my phone and they can tell me what's going on and prescribe my medicine. I can go to the pharmacy and pick up my medicine. That's another way to bridge the gap and provide more access to people. In addition to that, we need to start thinking about medicine. For someone that cannot afford to eat, you know, how are they going to pay for drugs? The drugs are so expensive. I'll give you an example. The last mission I ran to Africa was to Ile-Ife. I went to a village there, and on this last day, we saw over 500 patients. And I saw this guy that has a high blood pressure. Pressure was so high, the vein in his neck was about to explode. And I said, you know what? We will take you to the hospital in Ibadan. We'll pay for it. And he said, no, how am I going to get back to my family? And when I go to that hospital, who's going to pay the rest of the bill when you guys leave? And you have some patient where we provide medication to, enough for a month. But after that 1 month, they can afford to sustain that. They can't pay for the rest of the medicine. So we have a lot of granular problem that we have to fix first. But when we talk about technology, you know, they started using smart lockers or medication dispensaries that you can put in different locations where in a community that has a clinic, and you can make sure that this smart lock is stocked with the necessary medicine. So when they see the doctor via telehealth, they can go to the dispensary and get the medicine from the dispensary. So smart lock is another opportunity for us to leverage technology in Africa. So telemedicine, utilization of drone services to get to remote areas in terms of delivering necessary medication and vaccine and all that. Telehealth medicine, They'll grant access to the masses that have cell phone, and also thinking about smart lock system or medication dispensary system in different localities that people can have access to based on their conversation with a physician, and they'll give them the code to get their medicine from the smart lock. So those are the three things that I think is easy to accomplish. And some people are beginning to brainstorm on how to execute that now. And some of them are already going on now, and we just need to build on it.
Thank you so much, Dr. Adimoli. And I think you touched on an issue that I'm very passionate about, for one. You know, when you speak about things like drone technologies to deliver pharmaceuticals and to use it to deliver the different blood samples, I know that Rwanda is a beautiful case study for that. I know Rwanda is currently using drone technologies, or was using it during the COVID to just deliver things to and from remote places, right? But I think a problem that we have, especially, I'm a co-founder of a telemedicine platform here in Botswana, right? So a challenge that we have is the private sector has adopted the solution. You know, its private sector uptake is marvelous, it's beautiful. And then we come to the public sector where the real problems are. It's a challenge to really get them to adopt solutions. And like you said, I think it's a leadership vacuum. It's an issue of leadership really not wanting to enhance health infrastructure by using these technologies. So maybe, Mr. Adimoli, I can just pick your brain. How do we stop, or how do we encourage the public sector to actually just adopt these solutions? Because right now it's really, really difficult to try and convince the public sector to use technologies in Botswana. I don't know about Cameroon or the other countries, but that's what's currently happening in Botswana.
Okay. I think we need to encourage the government, because they cannot do it alone. It's already very difficult for governments they have failed in so many ways, especially in the healthcare system. We have public hospitals that are saturated. So I think I encourage them to be able to create environments where these technologies can be accepted. I think we have a lady here in Cameroon who created a blood bank, and she currently uses technology, you know, where if patients need blood, they can easily call her and blood gets delivered to where she is, just like in Nigeria, where we have Femi doing the same work. And sometimes you go to the hospital here, there's no blood in the blood bank, and people die every day because there's no blood in the blood bank. So why not accept people who are coming in as entrepreneurs or from private sectors, or tech entrepreneurs who can come and do things like that? So they need to. I think they really need to encourage the public sectors to accept different innovations coming in to help with the public, with the healthcare system.
I wanted to say something there, because I really like where you're going with that. And you have a lot of entrepreneurs, you know, like yourself, like Morenike, like Nkala, that wants to do things. I have partners here in the States that want to go do things there, but they find a way to frustrate you. You know, They find a way to frustrate you. The bribery and corruption is just too much. I have a friend that went to his village that built a 20-bed clinic to help the community. And to do the final inspection, they were asking for money for them to certify the clinic to operate. It was so frustrated, it closed the clinic and came back to the US and said, I'm never going back again. So we have this mentality of corruption that we do not see the general needs of others, but we always put ourselves first. And that frustrates people. People tell me that, Demola, if you want to go invest in Nigeria, you're not going to survive, because you're so straightforward. You don't like the narrow stuff. You have ideas you want to implement. You have ideas you want to execute. But the roadblock is just insurmountable unless you play the game. So I'm beginning to learn how to play the game in order to make things happen. Because if you say I'm not going to play the game, then things are not going to happen. So you have to figure out how to play the game to be able to execute.
Thank you, Dr. Adimoli. That was a very great insight, and I think I agree with you. Honestly, I think sometimes that's what it takes, because, like in Botswana here, we have somebody who tried to also implement the smart lockers that you're speaking about, right? So our pharmaceuticals there's always a congestion, a backlog. So somebody had developed a solution that actually just tracks the pharmaceutical and generates data to help them with the ordering process, and then the smart locker would then just deliver that medication. And guess what? There's just bureaucracy and red tape everywhere. Like, it's so difficult, but it's something that our country needs. Our
Yeah,
country is really, really suffering a lot.
exactly.
So I think you're right when you say, I guess sometimes you just have to play along with what they are doing, right? So I think we've spoken a lot about technology and we've really delved a lot into it. So I think I just want to ask you, Lillian, we've been talking about all these solutions to actually improve healthcare infrastructure. How do you think this will benefit our economy as
Thank you,
Africa?
thank you so much for that question. You know, Africa is well equipped. I'll give you a story. So recently, I was in South Africa in March, and I packed two luggages to go with me and a backpack as my carry-on. Well, in my packing, I thought, well, I would need all of these things because I don't want to spend any extra funds on what I already possess, right? So my luggages did not arrive for 5 days while I was in South Africa. So it forced me to go shopping for different things, right? And at the end of the trip, the conclusion that I had is that Africa has everything I need. All I simply need to do is to show up. So if Africa has everything, why can't we as Africans, as people from all over the country, as people from all over the world, come together to give Africa the assistance in the creating a better infrastructure, setting the plan, and for Africa to receive it. It's a different story when we want to help, but Africa is not open. Our leaders in Africa are not open to receiving the help, and the people that are dying from maternal and child mortality, and also dying from COVID, or dying from Ebola, or dying from flu, or dying from different communicable diseases that are easily preventable here in America where I reside. Why can't we do that? Why can't we? Why can't our leaders in Africa be willing to accept the help, to accept what we have to offer? You know, um, if Africa was to change its way of performance in each and every country, it will make America stand up strong. It will make America look at Africans in a different light. It will make Americans have a different kind of respect for Africa. So I just hope that moving forward, coming together as a collective, we can all work towards helping Dr. Adewale with his IT technology program that he wants to implement in Nigeria, helping Dr. Kuja with what she it wants to implement in Cameroon, and just also supporting you, Ms. Nakala, with your tech genius, in Botswana. So coming together collectively, we can be very powerful.
Thank you so much, Lillian. I do believe that there is power in unity. Maybe if we all brought our voices in one, maybe our leaders would actually take action and they would listen to us, to some of the comments that we have. If we have esteemed doctors like yourselves actually just voicing them out. And this is the perfect platform for that, right? So here we're just discussing these issues. So, we're not going to forget to talk about those marginalized communities. And I know, Mary Claire, that you're very passionate about the marginalized communities, those, the disciple, and all that. So I just want to pick your brain. What are your recommendations for Africans in the Disciple who might be wanting to create solutions, but perhaps they're scared or they think that their ideas are not valid? Remember that these are the people who are really affected by the lack of infrastructure. So, what are your recommendations?
It's I could start.
Okay, so first things first, the leadership in Africa is very difficult. They have a very hostile environment for people from the diaspora to come and work here. But my encouragement to anyone in the diaspora who have the passion and the people of Africa, of the different countries in their hearts, is you have to leave fears aside and come anyway and create those initiatives. Because if we don't do it, who else is going to do it? We have to force and push through. And then, for instance, here in Cameroon, I was coming to start this initiative. Many people told me that, oh, the tax system will make me to run away back to the US. The system, the dirty systems here, the bribery and corruptions will send me back to the US. Of course, I've been frustrated here so many times because there's no iota of support for entrepreneurs here in Cameroon. I mean, an iota, there's no support. And so I've even won prizes from abroad, financial prizes that I'm not able to receive them here because when they get into banks, they want to investigate those money. They keep them there for months because they want to investigate the money. Yet they don't support me right in here. So I just want to encourage people in the diaspora that you have to come in. We need tech entrepreneurs to create healthcare solutions. We need people to come and create, for instance, the air ambulance, like they do in Nigeria. We need people to come and open clinics in different communities to serve our people. People are really dying and suffering here. And it really takes this generation of Africans in the diaspora that I really believe we have a lot of what it takes to create solutions here. So I think that's a bit I can say about how we can work in Cameroon and in other parts of Africa. We need to force and come in and then also follow the laws, whatever laws they have put in place, and respect them. Because when I came here, I had to register with the Ministry of Small and Medium-Sized Enterprises and follow their rules and regulations, so that I don't get into any problems. And then I also have people at the taxation department that I go there every month to ask what I'm supposed to do. So many people are afraid of all of these things, but when you come in as someone from the diaspora who wants to create a solution, go to all the areas that you need to work with. Go to taxation, go to small and medium-sized enterprises, go to your local delegations and ask questions. They will lead you on how you can do it and do your business and stay away from trouble. If we follow those rules, we will not have any problems operating here.
Thank you so much, Mary Claire. Dr. Ademola, I know that this is something that you're very passionate about. You can chip in and tell us, what do you think, your recommendations? These are the people who are hardest hit by the lack of infrastructure.
Yeah. I think where there's a will, there's a way. And you cannot be afraid to take the first step. You fail, you stand up and you try again. When you look at Nigeria, for an example, with a population of over 250 million, 180 million, and there's only 3% penetration of hospital in Nigeria. And most of the hospitals are between Lagos and Abuja. That's it. So the entire country, there's really nothing else. You have a small pox and chops, supposedly called hospitals. So people are beginning to come in and realize that in order for us to do this, we have to put our money where our mouth is and bring our resources. We cannot continue to rely on the government. However, at the same time, we have to figure out how to have a network of collaborators that will help us navigate the road so that the obstacle that the regulators or bureaucrats have put in place can be easily navigated and allow us to excel in what we're trying to do. And that is the only way to go. You have to be collaborative. You can't just come in there like a cowboy. This is what I want to do, and I want to do this. You have to figure out how to play the game. Play the game nicely to the level that you're comfortable with, but at the same time, you cannot let fear drive you from doing the same. If you look at it right now in the diaspora, most of our young doctors are emigrating out of the continent. In the United States, we have about close to 100,000 Nigerian doctors here practicing. Why are they here? If there's an infrastructure at home, I would be in Nigeria right now practicing medicine. you know, and I can tell you several colleagues of mine that would love to do the same, but it's like the structure is not there. So we have to continue to go on and invest and work with the legislator, with the bureaucrats, and trying to see if we could change their mindset to see things from a different perspective. And I think that's the only way, I think, one of the ways that we can excel in making this happen in Africa.
Thank you so much, Dr. Edimola. I couldn't agree with you more. You know, I'm a practicing attorney. I'm a lawyer currently here in Botswana. And when you say that there's a lot of legislation gap, I totally agree with you. And I think a lot of problems is our legislators don't actually go onto the ground. They don't know what's happening on the ground. So we kind of put a lot of red tape for some of these innovations to come to play. So I think I completely understand and I agree on what you're saying. You know, this has been a beautiful, beautiful session where we have been talking about expanding quality healthcare infrastructure in mainstream Africa, you know. And I know that you all have closing remarks that you'd love to say, because this has been a very exciting topic for all of us. We all want to see a better Africa. So in closing, Lillian, can you just tell us, what would you say?
Thank you so much for having me. This was an amazing opportunity. And I would like to say in closing that as Africans, we are given a duty. We're given a duty to, us Africans in the diaspora, I would say, are given a duty to bring back the information that we have gained, that we have perfected in our individual professions, to use that for the betterment of humanity. You know, money is a tool, right? We use money to do things. We use money to achieve things, to make things move. So if we have our hearts, our conscience in the right place, there is no issue with funding because the money is there. It's a resource for us that's available. So if we come together, have everything that we need in one line, collectively, we can build a better Africa. We can move Africa forward. We can establish a healthcare system where doctors and nurses from abroad will be able to come and work, come and perform, come and give back in the way that it is insurmountable, in the way that is endless. So I urge and I plead with our governments to please allow the people in the diaspora, allow the people in your countries to come and do the good work. Come and do what is necessary. Come and fix the areas where we can all benefit. Thank you.
Thank you so much, Lillian. That was very touching, and I do hope that our leaders actually listen to our inputs and they can see that. And I know you're a doctor based in the US. They can see that you guys have a burning desire to come and give back to the land that grew you up and all that.
Absolutely.
But you are being stopped to do that, and I hope that they can see that. You know, we have a lot of talented, educated people in Africa. We just need to improve our infrastructure and the way we do things. Dr. Ademola, any closing remarks?
Well, thank you very much for having me. I think this is a phenomenal forum, and I'm just glad to be here. And just being on this forum, I see some potential collaborations here. In closing, what I'll say is I'll say exactly what I started with. Any venture I go into, I go with values, vision, and mission. Until we start having leaders with the values that are necessary to lead effectively, our vision will always be clouded. And once our vision is clouded, we cannot see clearly to execute our mission. So how do we now go on and start teaching the young generation that before you venture into anything, you need to clearly define your values, define your vision, and define your mission. And that is the only way we can move forward. You can have a mission, you can have a vision, but without the values to back it up, it's going to fail. So, how do we build our moral ethos and character that will allow us to see beyond tribalism, to see beyond nepotism, to see beyond greed and corruption, to see beyond not becoming a servant leader? Until we have all those, it's hard to move forward. So we need to start teaching the young generation to develop values that will allow them to have a clear vision and be able to execute our mission. Thank you.
Thank you so much, Dr. Adimoli. I love that. Values, vision, and mission. This is what Africa needs. We need to have clearly defined values, and we need to have a vision and mission. Thank you so much, Dr. Adimoli. Mary, closing remarks?
Okay, I just want to thank you, Nkala, and Dr. Adewale and Lillian. Nice to meet you all virtually. I think my last word would be to talk about fear. Fear is that one thing that has crippled a lot of people. It has stopped so many people from achieving their dreams. So they die and carry all the gifts and talents, all the assignments that God gave them back to their graves. So I want to encourage anyone who will be watching this and all of us here that when we leave fear aside and venture out in faith, what happens is amazing. You change the lives of millions of people when you leave fear aside. So I just want to encourage everyone in the diaspora who will be listening to this. I'm in Cameroon, and I'm not only in Cameroon, I'm in the northwest region of Cameroon where there's a war going on right now. Many people are wondering how I'm doing it here, but I'm here anyway. So I want to encourage everyone, if I can do it, you can do it. We have what it takes as Africans. We really have what it takes. So what is the worst thing that can happen? You fall, you hit a toe, you break a knee, you get up and keep going. You fall 99 times and win the 100th time. So this is what I want to say to everyone out there who will be watching. I really encourage you to come home and let's create initiatives to save our country, our continent. Thank you.
Thank you so much, Mary Claire. And I love those words. I love those words. You say, keep falling. Nobody ever succeeds from not trying, right? And as an entrepreneur, and I think those are beautiful words. Those are beautiful words. Nothing good ever comes from not trying. We need to try. We need to keep innovating. We need to keep trying to make Africa a better place. Thank you so much, esteemed panelists. It has been an absolute pleasure moderating this. Thank you so much.
Thank you. Thank you. You guys stay safe, and you in Cameroon stay safe, okay?
Yes.
Thank you, Doctor.
Okay.
Thank you.
Bye-bye.
Thank you, Lillian.
Okay, bye-bye.
Nice to meet you.
Bless you.
Nice to meet you. Bye-bye.
Nice to meet you too.